Recent medical research shows that 7 out of 10 seniors who manage neuropathy with lifestyle adjustments experience significant relief. Today, we'll explore how you can effectively manage neuropathy, a common issue among older adults that can impact your quality of life. If you're experiencing nerve pain or numbness, know that you are not alone, and there are steps you can take to regain control and comfort in your daily life. Join us at Seniors Health Companion as we guide you through this journey with empathy and expertise. Imagine your nerves as electrical wires that transmit signals throughout your body. In neuropathy, these wires become damaged, causing pain, tingling, and numbness, primarily in the hands and feet. Aging and certain conditions like diabetes can increase the likelihood of developing neuropathy. Understanding how your body works is the first step to managing these sensations. Remember, this condition is not a reflection of personal failure, but a health issue that can be addressed with the right tools. Early signs of neuropathy can be subtle, often starting with a tingling or numbness in your fingers or toes. As it progresses, you might notice pain or weakness. It's important to listen to your body and note these changes. When you catch these symptoms early, you can seek help and prevent the condition from worsening, enhancing your long-term comfort and mobility. Don't hesitate to discuss any such signs with your healthcare provider. Nutrition plays a powerful role in managing neuropathy. Consider integrating foods rich in vitamins B and D, found in eggs, fish, and whole grains to support nerve health. Including antioxidant-rich foods like berries and leafy greens can fight inflammation, a common aggravator of nerve pain. Timing your meals to maintain stable blood sugar levels is also crucial, especially if diabetes is a factor. Simple dietary changes can significantly ease symptoms and improve your overall health. Staying active is key to managing neuropathy without overstraining your body. Gentle exercises like Tai Chi or water aerobics can improve circulation and strength, which helps reduce pain and numbness. Always start with slow and deliberate movements to prevent injury. For those with limited mobility, seated exercises offer a safe way to stay active while catering to individual abilities. Prioritize consistency over intensity to build endurance gradually. Regular medical monitoring is essential in managing neuropathy. Schedule routine checkups to track your progress and make informed decisions about your care plan. Work closely with your healthcare provider to adjust treatments as needed and discuss any new symptoms promptly. In certain situations, immediate medical attention may be necessary to prevent complications. Being proactive with professional care ensures that your health decisions are well-informed and personalized. Neuropathy can take an emotional toll, affecting your mood and social interactions. It's important to stay connected with loved ones and engage in social activities that uplift your spirit. Practicing mindfulness or gentle yoga can enhance mental clarity and positivity. Consider joining support groups where you can share experiences and gain encouragement. Maintaining a positive outlook and addressing any emotional challenges head-on can significantly improve your quality of life. If you're watching this, you care about your health, and that's already the most important step you can take. Remember, managing neuropathy is a journey, not a race. By understanding your body, fostering a healthful lifestyle, and staying proactive in your care, you are empowered to take control of your well-being. Start today by making small changes to your routine and watch as your quality of life improves. You're not alone on this path. Seniors Health Companion is here to support you in every way.